Dustin has over 20 years of experience in advocacy in freelance policy, government relations, and public affairs. Dustin spent nearly 3.5 years at Weed Maps, where he built and managed a 20-person international policy and government relations team and guided associated federal, state, and local and international government engagements on cannabis policy issues. Dustin joined Weed Maps in 2016 after serving for 3.5 years as the director of the Government Finance Officers Association. That's GFOA, their Federal Liaison Center, where he led advocacy on municipal finance issues for a coalition of state, county, and city government associations.
Let me go get a ice.
At GFOA, Dustin also served as lead staff on the
Did you look the
committee
to figure out who it was?
on governmental debt management, working with committee members to develop best practices that promote sound financial practices for state and local governments. Prior to his work with GFOA, Dustin spent 10 years providing direct federal advocacy services to local governments and local government agencies from across the U.S., working as a member of Holland and Knight's Public Policy and Regulation Group, as well as the government relation practice of MARC Associates. In this role, Dustin led successful advocacy campaigns on a diverse group of issues, including municipal tax finance and tax reform, multimodal transportation and related infrastructure, housing and economic development, water and wastewater infrastructure improvements, telecommunications reform, public safety, and manufacturing. Before entering the private sector, Dustin served as the staff in Washington, D.C. office of a member of the California congressional delegation. In addition to his role with ASA, Dustin also helps cannabis businesses and local governments organize functional policy addressing patients' needs and challenges through the Square Root Group. Dustin, thanks for being here. And I'll hand it off to Shelly and let her talk about what we're going to talk about tonight.
Thanks. Thank you, Alicia, for the introduction. And I'm super excited to hear from you tonight, Dustin. So thank you again for coming or for being here on our Zoom session. So I just wanted to kind of give just a broad overview of, we have a lot of new regulations in place and why, just maybe why we've even come to this, why we're dealing with some new regulations in this industry that's been going on legally for almost 4 years now. So for nearly 4 years, 3 different state programs licensed and regulated California cannabis businesses. They were the Bureau of Cannabis Control in the Department of Consumer Affairs, the Manufactured Cannabis Safety Branch in the Department of Public Health, Cal Cannabis Cultivation Licensing in the Department of Food and Agriculture. In 2020, Governor Newsom proposed to simplify that structure by merging the 3 cannabis programs into a single new state department. California created the Department of Cannabis Control on July 12, 2021. One of the DCC's first priorities is to combine the 3 sets of regulations from those 3 entities prior into one. The regulations have now been adopted. I think they were adopted September 29th or so, but so it's been fairly recent. But they've been adopted by the Department of Cannabis Control, and we will be talking about those changes today. There are 7 categories that were most affected by the recent regulations, of which include labeling and tagging, 2 returns and rejections, 3 destructions, 4 harvests, 5 branded merchandise, 6 COAs, and 7, one of the bigger ones is the trade samples. That was a big addition. So a prominent element of the regulations establishes rules allowing for trade samples between businesses, which was recently authorized by Assembly Bill 141. These rules include the type of licensees that can give and receive samples, packaging, tracking, and sample sizes. Prior to AB 141, business-to-business trade samples were allowed only if the product did not contain cannabis. While most of the changes affect the cannabis industry as a whole, the consumer is affected as well. Tonight, Dustin will be speaking to us about the changes and how it may affect the consumer. It is important to note that Americans for Safe Access had submitted a comment letter to the Department of Cannabis Control regarding these changes, which raised a number of outstanding patient issues that have been largely left unaddressed since the foundation of California's medical and adult use programs. The point of ASA's letter was to publicly raise these issues to the new head of DCC, who is loosely familiar with them, but who has also enunciated no action plan to approach addressing any of them. Dustin, I would love for you to focus on the consumer patient while talking about the changes that need to be made to the current newly adopted regulations. I do have one question, and you could, cover this at any point, but while the regulations, this pertains to the medical patient for me, this is a question kind of related more to that, but while the regulations do allow for free cannabis to medical patients, it's unclear how operators can donate. The current regulations state that cannabis can only be given for free if the patient has a doctor's medical recommendation. With the adoption of SB 34 in the state, this is now the path that licensed companies can donate cannabis tax-free. The current regulations state that a retailer must be an M retailer. If the current regulations do not allow for the adult use retailers to participate, it certainly should be amended or clarified so that all retailers in the state can donate via the Senate Bill 34. So how can we as advocates just even help to make that change?
Well, first, I just want to thank Shelley and Alicia for the introduction, and also to Candace in this chapter for inviting me to come and speak with y'all. It's really a pleasure to get a chance to actually share some community with you guys, even if it's just online. Certainly looking forward to the chance when I get the opportunity to meet a bunch of you in person. Some of you already have. With respect to your additional question, Shelley, I think that's a great place to start, the SB 34 program. And I think as we drive through the changes that the state's organizing its regulations that at least had OAL sign into law on September 27th, looking at it through really kind of the functionality from a consumer patient standpoint. We have this system that's been online since 96 in one form or another. Legislature got to work on it deep in 15, and then we had 64 overlaid on top of it. Okay, well, we're 6 years, 7 years down the road now. What's going on with the system? Why isn't it functioning? To your point, affordability and availability of legal cannabis. There are two items that are attempted to be addressed to disadvantaged populations, especially during a national economic crisis as we're experiencing right now, have a lot of trouble affording cannabis medicine when there's no insurance overlay provided by national individual insurance carriers. So programs like SB 34 that California's organized are critical to ensuring patients can get access where they're economically disadvantaged. To your point, there needs to be clarity. So the letter for just kind of broadly speaking about Americans for Safe Access, this letter that we submitted to the state in response to the regulations, to Shelley's point, the items that we included in the letter really had nothing to do with the regulations themselves. And that was kind of the purpose of the way we phrased the letter. None of these regulations, as we'll drive through today, have a ton of impact on consumers. A lot to do with the industry and businesses, how they operate, things that can ultimately drive down price on consumers, where regulatory efficiency is achieved. I think we're a long way from that in California, though. But I think that's where they're trying to go here in reorganizing all of these different agencies, these three different agencies and their roles at the state level. Part of the idea here is to get to regulatory efficiency, but so much of the failures on the regulatory efficiency side emerge in oversight and enforcement, which we can also talk about. To your point about SB 34, that's one of the things that we're trying to improve in the letter. We did call out in the letter the need to ensure that regardless of your license type, although this wasn't specifically enunciated, we are having some conversations back and forth with DCC regulators on this to try to seek clarity, to your point. But I think also to your point, there's a collective way we can engage on that as we drive through the rest of Q4 21 and into Q1 22. But to your point, that's what we're trying to do at ASA, is seek clarity from the state to get an understanding. If you're an M license, if you're an A license, it shouldn't matter. You should still be subject to the same tax benefit for participating in the SB 34 program and ensuring that you're helping to supply medicine to disadvantaged patients. So I think seeking clarity is the answer there. ACE is working on basically doing a Q4 build out of what we want to do in 2022 across Fed, state, local, and certainly California. We held a call last week pulling advocates together to really brainstorm on a lot of those items on that list, also to include other things that were in the letter, like making JoJo's Act actually work to provide pediatric access to patients where school districts and local education agencies become a roadblock to the function of that program. Of course, we secured Governor Newsom finally signing into law Ryan's law, which is fantastic, but to make Ryan's law function, we need physician education. So that's got to be driven into Governor's Office of CDPH next. So there's a lot of reforms like that we're going to be driving at the state and local level in 22. And I think there's definitely some collective opportunities for us to weigh in and really make our voices heard in a meaningful way with DCC and other regulators to get some of these changes addressed. And, you know, a lot of the items that we call out for patients, everything from patient rights and civil protections, which we call out in the letter. I know the state of California's normal chapter is working on building out an employment protections bill that we're eager to work with them on going into the second year of this legislative session at the state level. So that's a big one that we certainly want to work on. You've got the Skinner bill out there, SB 398, that seeks to expand the number of legal retailers. Of course, we're all familiar with that problem all too well. 482 cities and 58 counties across the state, in which approximately 115 are authorizing retail. And of course, as we all know, most of those retail authorizations are capped systems, meaning it's not like an unlimited number of retailers, and they're certainly not in any proportion to the number of authorized local pharmacies. So these are kind of benchmarks we're trying to drive and meet and work with both folks at the state regulatory side as well as regional industry participants to knock out a lot of these items. So that's kind of the big picture about what ACE is trying to do as we pull our act together across Fed, state, and local for 2022. And I think, you know, there's a lot of excitement on that front, but I think for my purposes, over the last year and a half, yeah, I've been jamming with ASA, but it's kind of been me. You know, there hasn't been a lot of coordination. So it's really been over the last year that we've been able to, like, okay, we've revitalized the Mjbizcon chapter, you know, we're reorganizing the integration with building out a mission in California, what we're trying to do here, state and local, and we're trying to work with our regional advocates and our local advocates and state advocates and everybody who's on these calls, because to the point, I don't care if it's ACE or normal or whoever, the bottom line is these issues need to get fixed. And so we want to try to do everything we can to fix them and work with dedicated groups like this to do so. So we'll definitely be looking to do that in 2022, trying to solve for all those patient needs, from safe and legal access, affordable, safe medicine that's appropriately lab tested, going to the CAO piece that we'll talk about. These are all kind of the big ticket items that haven't been addressed since MCRSA became law legislatively, and that's important because it's the state doing this, not voters thrusting this upon the state. You know, it's the state that built the medical legislative package, so it's time for the state to kind of make it work. And that's what we're kind of dedicated to the mission of. With that, I'll dive a little bit into the state regs, and then we can have Q&A and kind of whatever you want to talk about. From, we can talk about AB 45, California finally has functional, also trying to have functional hemp, all the way through what's cooking at the Fed level or anything else you guys want to cover. I think the biggest thing to take away from these regs is that virtually every cannabis business that's got a state license, of course, got to have a local license in California, a dual license system. Every business that's been authorized by the state to do business in this space operates off of provisional licenses since 2016, which is insane. So, you know, the other thing that's been insane about it is that if you're a licensee in this space, you're doing all the work you need to do to do your job. You know, if you're a cultivator, you're cultivating, you're making sure your product's safe, and you're getting it to labs and testing it. And you're, you know, maybe white labeling to a manufacturer or something, but you're doing your job. Plus, you're trying to satisfy local and state compliance that's changing constantly. Oh, and by the way, your actual license that you need to survive isn't even a permanent license. It's just kind of this nebulous thing. So last summer, legislation passed AB 141. That legislation kind of put all the provisionals by licensing category, cultivation, manufacturing, distribution, labs, retail, on a track of like, okay, for each licensing category, here's your new sunset date about when your license is going to expire, your provisional license, and when you've got to re-up. So what they attempt to do in folding together these 3 sets of regs across these 3 previously existing regulatory agencies is to streamline them into one, and in doing so, make the licensing system functional. I'm crossing my fingers on that one. We'll see what happens when that happens. But there's a lot of good resources out there. Clark Howell put out a good 1-page on kind of like, here's a decision tree. If you're a cultivator, though, bottom line, I'll run through it real quick, and I'm happy to provide any of this information on the back end if folks need it. If you're a cultivator, large or small, you kind of need to have all your application materials in by 12/31 of this year, last day of the year. Manufacturers, you don't really need to have them in until end of January next year. If you're a micro biz, same thing, end of January next year. Distributors, you're looking at a end of March deadline, 3/31 next year. But for every reason, whether you're a distributor or a social equity applicant who also have a 1/31/22 deadline for submitting applications, or 3/31 deadline, even though it's a March deadline next year, you really want to try to make sure you get your stuff organized by end of January, so you get in the queue. Things are going to get messy. Things already are messy within the state system. They're only going to get messier as they try to merge all these systems. Imagine how well that's going to go. So you definitely want to try to get your stuff in early. Definitely make sure you check on the state's website. They've got revised filing forms. I can flip you links to all that stuff. If you don't feel like tracking them down, just feel free to hit me up. But that's all up on DCC's website now, and you can pull all that down. I don't know how much folks are interested in hearing about the updates to definition of aggregate ownership for financial interest holders, but those definitions were updated in a way. I think that aggregate business ownership definition is useful. Before it seemed like the state was using all this really nebulous language to try to get at who really owns this, and is not really so much who owns, but who's operating this business. And so with the new definition of 10% of the stock of a cannabis business individual shareholder, that defines that this person is an aggregate owner, but not an operator. And so I think that's what the state is trying to really differentiate from here, to understand that specific distinction. Then with respect to financial interest holders, that definition was largely the same, but DCC removed from that definition a person that contracts with a cannabis business to cultivate, manufacture, package, or label cannabis products under that person's brand name. So a slight deviation there that's supposed to simplify things a little bit for folks in that lane. Good news for folks, if you're on the cultivation side, you no longer have to pay any kind of fees for any kind of premises modifications that you have to supply to the state. Ordinarily, under the previous rules, if you were going to submit a new diagram saying, hey, here's my new cult diagram for my indoor operation, you would have to pay a fee associated with just updating them with the diagram. You won't have to do that anymore, but something that folks should be aware if you're working on the indoor grow side. Obviously, there's a lot of different variations of how you can organize that grow, but for vertical grows, if you've got a multi-shell system, they want to know all the dimensions of that. They want to know exactly how many shells you have and what all that looks like. So that's brand new for the regs this year, which may mean regulators are trying to get a little bit smarter in understanding the direction of where vertical is going. Good news on the merch side, now you can brand merch like it's going out of style. And basically you can brand anything that doesn't have cannabis in it. So, clothing, hats, t-shirts, pens, anything you want to slap your logo on, that's fine. The only caveat the state throws out there, and this is all compliant by 1/1/22. So end of this year, first day of next year is when all these regs hit the road on the merch side. But basically, you'll have to have your license number printed on the outside of the shirt, which is kind of interesting, or whatever merch it is you're cooking up. You'll have to have a license number on it in a way that's legible on the outside. So that's kind of an FYI for folks who are in the merch making game, or have merch associated with their products. I think Shelley talked about this a little bit, but the change with respect to trade samples. So, the sample designation, one, it can't be changed after the fact in metrics. So that's something to kind of keep in mind. If it's going to be a sample, you just have to kind of plug it that way into metric the first time you're plugging it in. You can't kind of go in after the fact and do that. Live plants and seeds won't be designated as trade samples. So don't count on using those. But so long as you're able to kind of plug the information in correctly in the metric on the front side, that shouldn't be a real issue there, but it should make life a little bit easier for folks in this business who are simply trying to share products. Also, the products don't have to be in their final form. So it's not like before we're like, okay, I'm taking them out, I'm writing them in my manifest, I'm going to go meet with this retailer and bring them these prepackaged 8s that are all wrapped up nice. It doesn't have to be like that under the new regs. We'll see, obviously, as the rubber meets the road, what really goes on with how these regs are interpreted, where there's issues. Certainly, you know, as we go into the end of this year, this last quarter, there'll be a lot of opportunities to raise these issues with the new DCC regulators, as well as kind of start plotting strategy for 2022 and how we might want to approach any changes to these regs. As I started this long-winded explanation about these regs, you heard me ramble on a lot about the letter that Americans for Safe Access submitted in response to these regs, which, as I mentioned, largely had nothing to do with these regs, because these regs largely don't have a lot to do with impact on consumers, with the exception of a few things in here that might ultimately help reduce product cost based on reducing costs for industry operators, but that's trickle-down economics, and we'll see how that bears out over time. Shelley did raise the piece on regs related to COAs. There was a slight change to COA regs that's probably worth mentioning. Things about COAs, I think folks on this call probably are pretty loosey-goosey in terms of compliance and oversight. But all of that aside, there was at least an exception available before, where your manufacturer name and contact information didn't necessarily have to be on the COA as it was going in it, but it could be applied later after things went through lab. That's no longer possible. So all that information from the manufacturer name and contact information has to be on that label as it goes into lab and come out the same on the other side. Challenge there, of course, was and is you're seeing a fair amount of duplications being made of other people's good COAs put on back products, to the point there's just simply isn't a sufficient amount of state or local oversight dedicated to solving for a lot of these things. So that's kind of the scoop there. So that's kind of a quick and dirty summary of the regs as they apply to businesses, they apply to consumers, giving you a little bit of an understanding about what Americans for Safe Access is trying to do across all of this. Happy to talk about AB 45, happy to talk about any coupon fed stuff, working that patch too, whatever you guys have questions on, happy to take them.
Well, thank you. That was excellent. That was a lot of information. You made
It was a lot.
Yeah, that was good. It was perfect. It was great. Thank you so much. I know that the merchandise thing is a big thing, and I've had people probably talk about that in samples the most and ask me the most questions. Do they have any kind of like grandfather clause for merchandise that was produced before 1/1, or do we all need to try to move all this merchandise before the 1st of January?
Unfortunately, they don't have any kind of grandfather clause, but you know, that's another thing that I know folks are seeking clarity on, because to your point, a lot of folks have plenty of merch sitting in boxes that, you know, I mean, you got to send it back to the silk screeners and have them slap your license number on it. Yeah, there's a lot of folks in that situation trying to figure that out. I would imagine the state ultimately figures out some way to allow that merch to still be sold, since we're not talking about some kind of product that people are ingesting, we're simply talking about merch. So that shouldn't be an issue, but I know that's something that folks be working to get the state to issue some clarification on before the end of the year.
That's excellent.
But to your point, Candace, I mean, you got a lot of folks who are pissed about that one. So
Yeah,
I bet we see some movement there.
Yeah, trying to think about how they can attach those license numbers and such, you know, which for some products not so hard, but for others is going to be kind of difficult. Does anybody else have any other questions? I'm surprised Jackie doesn't. She works in compliance. Oh, unmute.
Well, I'm interested about the AB 45. The regs are, you know, they combined them and not a lot changed. The things that did change are, you know, the trade sample one's going to help a lot of my vertically integrated company, at least, you know, just because they're going to be able to legally actually give out the samples that they want to in pitching their product to other retail markets. So that does help. But the brand licensing thing, just like Candace said, having to put that license on all the brand merch, although it was written in to be on marketing material, nobody really thinks of a shirt or a hat, a wearable item as marketing, you know, unless your address is on it, it doesn't really appear to be marketing to your facility or product. But, you know, we're going to have to adapt, and it's going to be a lot of freebies, right? There's going to be a lot of customer appreciation days, getting cool sweaters out. And so I think that's going to help retail stores pitch it and brands pitch their product in a way, because they're going to give out all this free merch up until New Year's Eve. So
we could do it. We could do an OC normal clothing drive and just take all that merch and, you know.
Oh, see, and that's also what we can say. That's a good point, Dustin.
Great
you know,
idea.
we can totally pitch it to the brands and the companies that, hey, donate it to us, right? Donate it to ASA, donate it to OC Normal, donate it to our groups, so we can give back to the patients and consumers that are members of our organizations. I mean, that's actually a brilliant idea. But,
hopefully we can solve the regulatory issue before we get there.
I know, right? Well, enough of us have to complain. I know I was at Meadowlands last weekend, and the controllers were there. So, you know, one of the big takeaways was, just because they cut off a public comment period doesn't mean you can't public comment. So although we only had that 5 days after they had these emergency regs released to say anything, we can still call up and complain. We can still write in and complain. Those emails still exist. They still open them. Do it. Complain.
I think to your point, Jackie, you know, there's power in numbers. And I think while industry groups and consumer groups in the cannabis space have been fractured in how they collaborate and engage at the state level in a meaningful way, whether it's legislative or regulatory, I think those groups have been around enough that, and there are new groups emerging, of course, like the folks over at Mammoth, I know, put together some other trade group. But I think the point being that those groups are doing a good job at coalescing voices. And so I think we can rip a letter or organize some communication tool that facilitates that conversation. We can drive it through all of those groups right at DCC. And like you said, really kind of maximize the impact of those voices and getting DCC to realize, hey, you're getting letters from Associate, you're getting letters from CVCAN, you're getting letters from OC Normal, you're getting letters from Bay Area. You know, like these are all these regions in the state are telling you this doesn't work.
Right.
And really trying to like facilitate a conversation with regulators as we're in Q4, saying, hey, let's organize some emergency regs to emergency regs that can give us a little bit of shelter as we drive into the new year under this new system.
100%. I mean, we have to all work together to make any change possible. And, you know, Nicole Elliott, the new director of Cannabis Control, she actually was a speaker at Meadowlands and really nervous to be a part of this industry. She's really, you know, taking this as a big opportunity to make positive changes. And, you know, although a lot of promises aren't kept in many parts of our government, she did put out a big promise that she's going to be there to listen and be receptive. And she does want us to start that communication.
She's
and not stop, right?
No, agreed. And I think she's an interesting creature moving into the role. Lori Ajax, her predecessor, of course, coming over from alcohol, but not understanding any of the cannabis stuff, just jumping in blind. And it's not like she was jumping into, like, I think a lot of states, as they approach organizing regulations on cannabis, it's like they're creating regs for an industry that they think is going to come down the road tomorrow. No. It's been here a long time. It's incredibly sophisticated in how it operates. You got to catch up to it, not it catch up to you. And so I think the difference with Nicole a little bit is, while her heart is in local government, understand she comes from a dual jurisdiction, city and county in San Francisco. Her love will always be for cities and not for patients or consumers. So understand that right from go. But that said, she did run a multi-million-dollar program at Go Biz to steer social equity programs to local governments, recognizing, hey, we can't change the California state constitution with respect to local control. Local governments are never going to see that and allow you to do whatever you want in that city. And as somebody who lives in any kind of city, you probably don't want that. But for our purposes, obviously, we're all crazy to see more expansive retail deployment yesterday. So I think that's the frustration. But I think Nicole understands that. She understands that, look, I got to partner with cities, League of California Cities, CSAC, other regional groups to really get them to get educated and understand what they need to do. And, you know, I think she's willing to work with industry to try to do that. At the same time, you know, she takes it a little personal when you drive at the city issue. And so she's, in terms of somebody to negotiate this stuff with, I advise you to go in with kid gloves and be incredibly respectful. Because you know, I think, you know, she can be a little sensitive when it comes to really calling out the failure of municipalities on this. Look, I represented the League of California Cities for 15 years in Washington. I know very well the issues of local governments. They're primarily economics driven. I think to the point of Orange County, you know, I've chatted with some folks who are looking to jam, getting some locals open here. Inland Empire, you know, San Bernardino, Rivco, San Diego County, you're starting to see a lot of these kind of frozen jurisdictions that were locked up in the 2015 and early 2016. You know, the moratoriums put in place. You're starting to see some of that ice freeze. You're starting to see jurisdictions that laid down initial policy in 16 and 17 that might be outdated, uncompliant. You're starting to see them go back and make some fixes. So I think there's a lot more fertile ground out there, and she's aware of that. But to the point, you do have a different audience in this regulator, and somebody who I think is also, like you say, they're looking to make a name for themselves. They're looking to try to figure out a way to make California the shining example that we all know it definitely is not across the 36 state model right now.
Yeah, no, I completely agree. I just think we can't stop talking, and we have to definitely team up with other organizations, reach out to all of the businesses that actually exist in the industry to be that bridge. Because I think that all of our nonprofits act as that bridge. We are the bridge between the consumer, the patient, the local representatives. I mean, you name it, the businesses and all the owners that this affects. So, I mean, I think without us teaming up and speaking to each other and actually passing on that conversation to the regulators in a very respectful and cohesive manner, nothing will happen without that happening.
Agreed. And I think, you know, there's a lot of things that we're trying to build out for 22, but I think one of the things we really want to focus on is something I did when I was at Weedmaps, like Weedmaps. But one of the things we tried to do was we're acknowledging that local governments were going to be your challenge in deploying functional retail. We're like, look, let's find a public safety expert, zoning and land use expert, rev and tax expert. Let's find all the experts these folks need to hear from. Let's put them in a room with these people, and they're going to tell them, hey, here's a state law. Here's your obligations under state law, take them or not. Here's the state of affairs in terms of industry organization across your state, challenges with licensing. Obviously, you've got supply side, oversight versus demand side. Here's what that means to you. Now, here's how you organize policy, locals. And so that was ineffective then because I think locals weren't ready then. You know, they just laid down those bans in 2016, and I'm coming at them in 17 and 18 with these panels. We put on one down in San Diego. I had one person come. I had a whole ballroom and all this shit. I had one person come, a city manager from Chula Vista. And you know what? We educated the crap out of that woman. But the bottom line is, like, I think that the atmosphere and the opportunity is right now. This wasn't there before, but now I'm rebuilding everything that I did back then. So I'm going to start building out the exact same panels.
Right.
We're working on putting together a medical cannabis symposium in NorCal for February. So, like, we're trying to start building out these events where, hey, it's not just industry talking to ourselves about our challenges. We're going to pull in local electeds. We're going to mash everybody together and start sorting out these issues. With some guidance, of course, but I think there's a lot of fertile ground there for us to attack, and that's something I'm going to be dedicated to going in.
It's so exciting, Dustin, but it's also, now that when you mentioned AB 45, that also flips the whole thing on its back, right? Because you're talking about just teaming up with the regulators, but now the cannabis industry has to team up with the hemp industry, and how is that going to work?
Well, and to your point, Jackie, I think, okay, you know, doing a little history, go back to the 2018 enactment of the Farm Bill. Hemp's not a pilot anymore; it's a national program, and USDA is looking to every state to submit their plan. California hasn't, sitting on his hands trying to figure out what day it is. And eventually, you know, we after multiple sessions, we passed AB 45, which is essentially what everybody wants. But you're still in this conundrum. I guess it's the same thing, really. Cannabis industry on the medical side, where you've got the appropriations overlay through Commerce Social Science. Here, you know, you've got protection under state law, but, you know, you're vulnerable on the FDA side. Anyway, there's only one FDA approved product that's compliant, and that's Epidiolex. I don't anticipate most or any of the people who manufacture CBD across this country who are not a pharmaceutical company will be going down that road of FDA authorization anytime soon. It's a 10 to 15 year process that costs a lot of money. So I don't anticipate that happening. So I think, yeah, AB 45, to your point, Jackie, exciting. But I mean, look, there's so many of these trap shops across the state that claim that if you look at the sign in the front, it's a CBD or a CBD shop, or maybe they're on a menu of your favorite lifting provider, and their menu is listed as a CBD menu. But when you click through, you're like, wait a minute, does Disney make CBD pens? I didn't realize that. So like there's a lot of kind of games being played here, a lot of lack of regulatory oversight, and I guess to your point, regulators currently don't have the staffing capacity to do their jobs well with respect to oversight and enforcement. Now we've just added a whole other layer on a CBD that wasn't regulated or policed before, and much of the illegal cannabis businesses flowed into that world. So what level of regulatory oversight and enforcement can we expect now? I'm guessing zero.
It's scary. And especially after they just passed the emergency regs, they weren't even prepared for this one.
Just go walk away, right?
Because I mean, it opens up a whole avenue for manufacturers in the cannabis industry. I mean, it's really blurring a line between what can be allowed. I just skimmed through the bill earlier, and I saw, they're going to have to come up with a division for this oversight. So that means that they're really going to have to find staffing. And are they going to find that by June of 2022? What's going to happen between now and June? How crazy is it going to be?
Well, to your point, I forgot to mention this in the regs, but one of the things they also tried to address was license stacking, right? So before you could say, okay, I'm all these different entities, even though my parcels of facilities are contiguous. So you can't do that anymore if you're the same licensee. So I should mention that, but yeah. To your point, it's going to be a lot of that shell game going on in 2022.
Yeah.
And then the next year, on the stacking thing, January 1, 23 is when the acre plus or 22,000 square feet plus license kicks in, the extra large license, if you will. So I guess to your point on compliance and regulatory oversight, do regulators actually have their act together to run oversight on contiguous parcels by different entities that are actually the same entity,
right?
Over the course of a single year, that at the end of which none of that will matter and all that will go right in the trash. I'm thinking there's probably not a lot of oversight lent there either, except for when they see on paper, oh wow, looking, these are right next to each other, except for when it's super obvious, right?
It's true. Yeah, I mean, I think that that's what's hard about this industry is, although a lot of us that are activists and advocates have been in here for a while, and we've seen Prop 215, we've seen it go from 1996 on and how far we've come. And then with the last 4 years of how far we've come with Prop 64. And then we still are in this confused land of, regulators over-regulating, but not regulating enough, not knowing what they're doing, not going in the right places, picking and choosing when they want to fine and not fine. And it's just completely ambiguous. And if there was ever a word that was better to describe the industry, it really is. It just leaves too much up, and it's constantly changing.
Pretty show.
Yeah.
More of the same.
Yeah. But I honestly appreciate your presence tonight, Dustin. You've just been incredible and insightful, and your energy is infectious, and I just hope that we can spread this type of advocacy to everybody that's listening today. I know we put this recording on our YouTube channel, and we do like to pitch it out on our Instagram and let people share, and please follow along with Dustin's journey with ASA, and all the letters that you send. We have to just keep on connecting, making these connections, keeping the connections, and not shutting up, right?
Agreed, 100%. And I'll say this, and then I'll stop rambling on. But to the extent I can be helpful with anything you guys are trying to drive, if you guys want to coordinate on stuff that we're doing with ASA, very much want to row together. I think so much of the challenges we had before in getting a lot of the changes we need through were political obstacles and lack of coordination among, candidly, functional advocates. There are folks who understand how to do this work, and there are folks who are really good at being there for it. And I think we've got enough people together now that understand, hey, this is how you build a campaign to make the state do this or that. And so I think that's what we're starting to build out now, especially as we drive towards 22 and we're looking at election cycles, all kinds of ballot initiatives, opportunities to threaten local governments with ordinances, and then, you know, kind of working with them on the website. A lot of those kinds of games going at the local level plus the state stuff. So I'll be working on all that stuff. Happy to plug in with anybody on this call to jam on that.
Right.
Wonderful.
I also go ahead, Bill. You can ask a question. I was going to make a statement.
I was just going to, at the recent CBD Expo, there was Delta 9 products, and there was even a group called Trojan Horse that had a CBD derived THC product that was supposedly, you know, a fraction of the actual weight of the product. The regulations, are any of the new regulations going to deal with any of the, again, the Delta 8s or the Delta 10, you know, these other cannabinoids that are being created from hemp products that are, you know, they're being claimed to be legal because they're derived from hemp under the Farm Bill, but ultimately some of the products actually had THC in them, you know.
Going to be really interesting, Bill, to see exactly where regulators go. You've got DCC organizing regs on it. You've got CDPH organizing regs, which I think is more the side you're talking about, with kind of really understanding what are the plant compounds associated with you know, there's so much that's still so loose on that, to include Delta 8, you know, the webinar that somebody mentioned I was doing earlier, the Phil mentioned I was doing earlier, was driving through the CannaKeys platform. And, you know, through that webinar, you know, we learned that there's only been a single study across the entire country conducted on Delta 8 so far. So, you know, the science is pretty shallow as it exists. Long way to go there. Just given California's history, I'm not expecting them to be a great leader in organizing regulations around Delta 8 or any other plant compounds, but that remains to be seen. Again, you've got a California Department of Public Health that still is looking at cannabis through the lens of Schedule 1, not so much as a product that has medicinal value that we're actually using to treat a variety of health conditions from physical to neurological. So there's a paradigm shift that we've got to get to occur in CDPH, I think, before they're willing to like really kind of dig in on that turf. It's excited to see what they end up turning out. I think we'll definitely see all of that being built this quarter, with that kind of stuff being unveiled probably early in January of 22.
I wanted to let you know too about something that we're doing that may help and assist you in what you guys are doing. Now, you know, it sounds like you're working at the city level trying to educate those folks. We've run into, like, on our local level here in Orange County and Fullerton, just large groups of uneducated citizens that show up in large droves with very, you know, passionate, misinformed pleas, you know, all sorts of crazy stories and stuff. So we've started something called the FACES program, Fostering Awareness for Cannabis Education Services. And we're going to start going to these cities that are going to be approaching regulations in the future and holding town halls, public information sessions for all these citizens who have all these misguided, you know, conceptions about cannabis. Come, you know, air their thought, you know, their what they think about cannabis, and we can try to neutralize them. We're not expecting to win them over, but at least neutralize them. So when the cities do present regulations, you know, we don't have like 50 to 60 people showing up at a meeting to scare away the city council members.
I think that's a great idea. And Candace, of course, you know, all the grass tops people, that'd be good to plug into that, like Bonnie and other good physicians. And I think the way to go is ID the constituent groups, right? All the parent groups, all the NIMBYs that are going to come out, right? You're going to invite all those folks. I'm happy to plug in and plan with you all this stuff, but I think that's a great idea. Invite all those folks in and make sure you get your city managers, your city attorneys, and your city electeds there. So like they see all this going on, they see, hey, we did this outreach. We really tried to make all these folks aware of the facts about cannabis, and we wanted you to be a part of it, you know, really kind of bringing everybody together. I agree. I think that's the way to really kind of knock down a lot of the obstacles we face is this education. People have been fed 80 years of stigma about cannabis, and lo and behold, it was effective.
Yeah, it's always amazing, you know, in this day and age, you don't really think that reefer madness is alive and well, but it really is sometimes when you come to these city council members. It's just you can't believe some of these things that come out of their mouths. So we just want to try to
I'm with you.
these things and clear them up. So
I've heard some wild ones. Yes.
go
I'm
on
with
about
you.
it.
Oh my gosh. Yeah, we can share some horror stories on that front.
Well, thank you so much, Dustin, for your time. Really, really appreciate it. We will definitely keep in touch and we'll work together. And we always just appreciate people like you and definitely Americans for Safe Access.
Thank you so much again for having me, Candace. Thanks to everybody in your chapter for tuning in. It's a pleasure to build a little community with everybody, and definitely looking forward to doing some work with you guys. Thank you again.
Yeah, thank you. Awesome. Okay. After that, we're going to go ahead and move on to our local updates. So I wanted to give you guys an update on 2 Orange County cities. The first one is Costa Mesa. So as you guys know, we've all been following that for quite a bit of time now. They are in the process of accepting applications, and they're up to about 60 applications that they've received as of to right now. The city is going to be processing 15 applications at a time. All the other applications that they receive after that are going to be put on a wait list. And according to the city's website, and I got this from Dana, there's 24 applications have made it past the pre-application phase and are on to the cannabis business permit phase. 15 are under review in the pre-application phase, and there's 21 businesses that are on the waiting list. So if you add those all together, it's about 59. So close to, we're going to probably have about 60, maybe more retail locations in Costa Mesa. Also, we just finally got a hold. We had heard rumors that there was a Huntington Beach group that was circulating a ballot measure in the city. And so we kind of put some feelers out there and asked if anybody knew what's going on. And we did get the ballot initiative sent to us, I think just like last night or yesterday. So we really haven't had time to go over it. We really don't even know who submitted it yet. So if anybody knows who submitted it, you can find the draft on the city's website, and we have it just in case you're interested in it. The version I saw came through on my phone, and it was really blurry, so I could kind of read it, but I couldn't read everything. But from like what I could like basically read, just so I like a scan over it and trying to like make it out, it seemed pretty standard. There was really nothing that stood out that I would say like, oh, this is a Matt Pappas initiative, or this is a Randall Longworth initiative. Like no like smoking bullet that really like tell you like who wrote it. Or even this new gentleman who just recently did it in Fullerton, that had language that was very heavily pro-union. So we're still on the hunt trying to kind of figure out who submitted this ballot initiative in Huntington Beach. It was just recent that they filed their statement. So we'll give you guys more information as that comes forward, but I just wanted to let you guys know that that is circulating. And when we had our task force functioning like 6 months ago, we actually had some members that were talking with members of the city in Huntington Beach, and they were actually saying that they wanted to put something forward on their own, but nothing really materialized. But there was some interest in the council to get something on the on an ordinance in the works. So being that this ballot initiative's out there, I assume that if they gather enough signatures, that they'll probably put up a ballot and another measure against theirs, or they could always just adopt their measure if they get the number of signatures they need to qualify. The city has the chance to adopt it then, or else they could put one up against it. So we'll keep an eye on that, and we'll let you guys know if you guys hear anything as well. The proponents I couldn't recognize them. So if you guys know who the attorney is or the sponsoring organization, it'd just be interesting to know. I kind of think it might be Catalyst. Catalyst is the group that sponsored the Fullerton ballot initiative that they submitted, but they never actually started collecting signatures. So it'll be interesting to see if this Huntington Beach petition was just, kind of like something that they were putting into play to kind of force the council to make a move, or if they really have an intention to collect signatures. So we'll keep you guys updated on that. All right. Moving on from that, I just wanted to give you guys an update on some of the legislation that the governor passed this year in 2 bills that he actually vetoed. Dustin already talked about AB 34. So AB 34 would ensure that the hemp industry is going to be regulated, tested, and eventually tracked similar to cannabis. And these were some of the demands that the cannabis industry was making. It states that a dietary supplement, food, beverage, cosmetic, or pet food is not adulterated by the inclusion of industrial hemp or cannabinoids, extracts, or derivatives from industrial hemp if those substances meet specified requirements and would prohibit restrictions on the sale of those items. So that was from Dana and like her email there. Also, there was a related bill, SB 929, which was signed by the governor, and it removes the Hemp Industry Association from the Hemp Advisory Board to make room for one more hemp farmer. And she's saying perhaps cannabis, has something to learn from this hemp bill and protecting the small businesses, which is kind of interesting. So that was the legislation that passed on hemp. And as we talked about before, and we talked about at other meetings as well, was AB 141 was also signed in by the governor. This is the bill that consolidated all the 3 licenses. So we've talked in length about this one, but that was another bill that was passed this year. The governor also signed AB 287, which would impose a 3-year statute of limitations on civil actions for penalties related to unlicensed commercial cannabis activity. He also signed AB 1138, which would impose a civil penalty on persons aiding and abetting unlicensed commercial cannabis activity, up to $30,000 for each violation. So the bill would prohibit filing an action for civil penalties brought against a person pursuant to MCRSA for 3 years after the date of discovery of the violation by a licensing authority or participating in agency. So that actually, I don't know why those got lumped in, but that second sentence actually sounds like it was matched with the AB 287. So I apologize for that. When I was writing this, I must have messed those up. So that AB 287 with the 3-year limitation, that was what that was about. The governor also signed AB 1222, which would authorize cannabis beverages to be packaged in glass containers that are clear or any color. He also signed AB 1305, which would exempt from MCRSA activity performed pursuant to DEA registration authorizing the cultivation and distribution of cannabis for research purposes. Didn't really hear anything about that one. SB 73 would delete past convictions for processing or transporting cannabis for those prohibitions against granting probation or a suspended sentence. So I guess it has to do on probation, and this is again from, I think this came from Jennifer McGrath's update. SB 166 would require the Department of Cannabis Control on or before January 1st to develop and implement a program to provide waivers for application fees, licensing fees, and renewal fees required by MCRSA. The bill would further require the department on or before January 1st, 2023 to develop and implement a program to provide deferrals of such fees. And then moving on to the last 3, SB 292 would require, among other things, hemp sampling to occur within a time frame determined by the Department of Food and Agriculture, a registrant to destroy or dispose of the industrial hemp grown upon the receipt of a laboratory test resulting in excessive THC, and third, that the laboratory tests of hemp include the measurement of uncertainty. So that actually was a bill that had to do with hemp. SB 311, as we know, and we've actually had him on here and we've done webinars, was the bill that would require specified types of healthcare facilities to allow terminally ill patients the use of medical cannabis within a healthcare facility, subject to certain restrictions. So that was Ryan's Law, who we've had his dad on here before. So very thankfully, this bill passed, as he talked about before. It passed unanimously in previous years, and the governor vetoed it. But his father worked tirelessly to get the support of hospital associations and to get them back down from their resistance to the bill. And it has passed. And now he's moving on to try to pass this in other states, which is wonderful. And then last one, SB 544 would require the Bureau on or before January 1st, 2023 to establish a standardized cannabinoid testing method to be used by all testing laboratories. So a little bit about like what Dustin talked about in standardization. Now, the 2 bills that the governor vetoed had to do with advertising. So he vetoed AB 273, which would remove the existing reference to advertising or marketing on billboards or similar devices visible from interstates, highways, or other state highways within California, and require that all signs, billboards meet specified requirements, such as not displaying things like animals, cannabis plants, leaves, foods, beverages, smoking, vaporizing, among others. So he vetoed that bill. And there was another similar bill, AB 1302, which would have prohibited advertising within a 15-mile radius of the California border on an interstate highway or state highway, which crosses our state border. These bills are in response to a California court determination and the BCC regulations regarding cannabis billboard advertising, and that it's invalid and that it's inconsistent with the statute and that the regulation was intended to implement. In other words, the statute's cannabis billboard prohibition on interstate highways or on state highways, which cross the California, is not limited to just a 15-mile radius of the California border. And then the note was that AB 302 passed, but was vetoed by the governor, who stated that it would weaken the protections passed in Prop 64 to shield youth from exposure to cannabis and cannabis advertising. So that was his reasoning there. And then there was like 11 bills that were also introduced that I actually couldn't find any notes on whether they were vetoed or whether they were signed. So I know, Dustin, you follow all these bills and such. Do you have any comments on that or any? We can't hear you.
I bet some of those bills are 2-year bills where they may be introduced in some fashion with no real action on them planned for this year, but they're getting jumped into next year, like the Skinner Bill 398 that would expand retail access, or at least as it's designed. As well as this employment bill that California State's Normal is building out. That one's designed to really kind of drive to the legislature this session and reach the government. So even though that bill was introduced, the Skinner Bill was introduced, the employment bill hasn't been introduced yet. But the Skinner Bill was introduced. It's kind of hanging out till this next year. The 22 will be the second year of the 2-year session when they'll try to do something on it. That said, look, I ran a bill kind of like that a couple of years ago and fell, 30 or 40 votes short of getting it through the assembly. I was able to get it out of committee, but once it reached the assembly floor, this gets back to our issue about education. Most of these lawmakers at the state level emerge from local government. So, that's kind of their turf too. And they're hearing from the same paranoid local government electeds about cannabis is going to come and ruin my town and poison my children and everything else. So, I think that's an obstacle that still remains for the Skinner Bill. And I think to the point about Nicole Elliott as the new head of DCC, I think there's an angle to work there a little bit. I don't know that the Skinner Bill becomes successful, but I don't know that you couldn't build enough momentum on it to kind of start forcing her hand a little bit on the regulatory side, or at least inspiring her more to address that challenge. But definitely some work to be done on that one going into 22.
Yeah. We had a busy year this year, and next year it seems like we're gonna have even busier. Okay, I attached in the chat a PDF of all the bills that I just read. So if you guys are interested in seeing that breakdown, and again, this wasn't information that I wrote up. This was collected from Dana Cisneros and from Jennifer McGrath, who are 2 different local Orange County attorneys. So I kind of sliced and diced their 2 emails and combined them to try to get like the most coverage. But if you're interested, it's in there for you guys. And then the last thing that we just want to go over is events, just to kind of keep you guys updated on what's going on here. So of course, we have a big event going on here in a couple days. Can you guys see the agenda? Is it showing? Okay, cool. So as far as events, we have a couple big events coming up next week. A lot of industry people are headed to Las Vegas. We have Mjbizcon happening at the Convention Center. And then also we have MJ Unpacked at the Mandalay Bay. And that's actually more retail and brand focused, more like California local centric, Nevada, I guess. A lot of brands are participating, like between the 2 states. Mjbizcon is, for those companies that are kind of like entering the industry, need to find their service providers, looking for new technology, new businesses and stuff to work with. That's really great. And, it's good to see all the new innovations and stuff and hear like their top level speakers, but there's also a lot to be found at this MJ Unpacked. And if you guys have never gone to Mjbizcon, it's a great time to go. You see all your reformer and activists and industry leaders and stakeholders from all across the country, kind of like when we used to have the normal conferences, and you get to see all your friends for a couple days and network and learn and share ideas and stuff. So this is kind of like a weekend, a whole city of doing that. And then also, like we talked about before, on October 30th, we're having our 420 bingo. And then on November 5th marks the 25-year celebration of Prop 215. And then also people like to remind me, it's also the 5-year anniversary of Prop 64. So we have 2 momentous occasions to celebrate. So California Normal is putting on a big event in San Francisco at the General's residence. A wonderful event featuring all the people who worked tirelessly to fight the bill and led the industry for many years are going to be speaking. We're going to have selected officials. Great time to see a lot of people from across the state who really worked to make Prop 215 and medical cannabis and the state work. So that'll be great. I do recommend anybody that is able to try to make it up to San Francisco for that event. And then also on December 8th through 9th, we have Hall of Flowers in Palm Springs. That's the first time they're coming down here to Southern California. We are going to work too to see if we can get a booth. We think that it'd be a great idea to have an SB 34 booth at Hall of Flowers, and then we can educate all those brands and retailers about the program. So that's our goal, and we're going to be reaching out to try to make that happen. Is there any other events, like local events, dispensary events, SB 34 giveaways, anything like that anybody wants to announce before we end?
On November 6th, for those who aren't going up to San Francisco, Philip and I are going to be meeting at the Lost Bean in Costa Mesa at 10:30. We're just going to try to do a daytime networking for people that are advocates or on wellness side of things, just to connect and get together. And I think just after COVID affected our how we work so much, just to kind of reconnect afterwards. That's where we'll be on November 6th, if anybody wants to come.
Perfect. Put that on the Orange County Normal Facebook page if you can, and you might get some people that want to attend.
Okay.
That'd be great. Also, I have a webinar next Tuesday. I think that's the 19th with Dr. Trin. For any of those who've worked with Dr. Trin from Laguna Woods, he's amazing. He's really fun. And so he's going to do a review of clinical and preclinical research on cannabis and cancer in honor of Breast Cancer Awareness Month in October. So that should be a lot of fun. And Dr. Trin is always a lot of fun as well, and very informative. He's with Alzheimer's OC and with Irvine Clinical Research, and works a lot in Laguna Woods and has the Healthy Brain Club. So he's really fun. All right. If there's no other announcements or anything, then I guess we can close the meeting.
I'll speak up just really quickly. The Cannabis Chamber of Commerce has a virtual event on the 28th at 1 o'clock. It's with Claiborne, and the topic is building a successful flower brand. So that will be pretty interesting. They kind of came out of nowhere and kind of hit everywhere fast. So I'll share that with you guys also.
Perfect. And that's the 28th of this month?
Yes, October 28th.
Great. Yeah, please do. Awesome.
Thanks.
Well, thank you guys. Thank you all. Really excited. And we are probably going to be voting in some new people that are going to be serving interim until we have our January elections next month. We are going to have Crystal come and take over as events director for Allison, who's also on the call. They're going to be working together while Allison is on maternity leave. So great. All right. So thank you guys so much, and we'll see you next month. Take care.
Bye, everyone.
Thank
Bye.
you.
Good night. Thank you.
Bye.